Our next guest comes to us, as he does every Thursday, from the great state Commonwealth of Kentucky, where, of course, he is the general chairman of healthwatchusa.org, and so great to have him on the program. Doctor, welcome. Happy Thursday, sir.
Well, thank you, Jeff.
Thank you for being here, because we have so much to talk about with you. It is a sad and very, very crazy time right now in America because of the lack of a federal response. And we have, at the very least, 3 states, not 4, that are in really crisis mode here. And I want to start off with the idea that we have scenarios, I believe, that CNN's reported in San Antonio, stating that they are starting to triage ICU beds with patients. The San Antonio doctor said if you want to see August 1st, maybe you should stay indoors and isolate on July 4th. That is some really strong language, and understandably so. Talk to us about first Texas, Florida, Arizona, and what is happening here and the danger of this thing spreading.
Well, the virus knows no geographic boundaries, so there is a danger of it spreading. What is very disturbing is that we saw this happening in Italy. We didn't take note of it. We then saw it happening in New York. Still, the United States didn't take note of it. We're now seeing it happening in Texas. And again, the same thing is happening. We are being reactive rather than proactive. And all of these sites are really starting to perform medicine similar to third world countries, where you're running out of supplies, you're running out of ICU beds, and you're having to triage and decide who lives and who dies. This is an extremely bad situation to be in. And as long as we have a strategy that we're going to wait till cases start rising before we worry about it and do anything, what we're going to see is epidemics continue to flare up and rage like a forest fire, and then we're going to have to try to put them out, instead of having a national proactive strategy to prevent spread. By the time you see a rise, it's too late. The virus is already throughout the community, and you're going to go through weeks and weeks of absolutely the worst ordeal you could imagine, with hospitals filled and ICU beds running out. So we need to be proactive. We need to have consistent messaging from the top, and we need to have a national strategy.
We're speaking with the great Dr. Kavanagh here on the Jeff Santos Show. Well, it's just heartbreaking to talk about, but you see the case with COVID-19 in Texas that went from 3% to 20% testing positive. It's hard to really think of. And at the end of this conversation, I want to talk to you about, what we're going to be talking in the last segment with our good friend Galen White from nearby Tennessee, to you about baseball teams that play in Florida. There's 2 teams in Tampa and Miami. There's another 2 teams in Houston and Dallas, and one in Arizona. I can't see how you could play baseball, or another team coming in from another state that's been doing the right thing and then potentially affecting their players. I mean, that to me is chaos. And sports is a big business. In some ways, if they can't get a hold of these things, they may have to cancel. Some of the teams may have to forfeit their games or move, which hopefully will be the case. But we'll get into that a little bit later. But these are these states and all the things that go around them. Now, I understand as well that another surrogate to the Trump campaign in Tulsa, Oklahoma, has tested positive, and that's the well-known pizza magnate, Herman Cain, who was one of the surrogates there. I mean, you have a president of the United States, and I know that we have tried to avoid spending too much time on the political elements, but the fact is the president of the United States, if he doesn't wear a mask, image-wise, people think that they can get away. Well, the president's not wearing a mask. Why do I have to wear a mask? That mentality. And I think that this is why people even on the more conservative Fox News channel are saying, why don't you wear a mask? And he had this whole thing about being the Lone Ranger and it looked cool, but we have not yet seen the president in any public appearances wearing a mask. I'm just wondering, from the perspective that if we're going to turn this around in those places that we mentioned, Orange County, California, and a few other places, Riverside County, Texas, Florida, and Arizona, and maybe 1 or 2 other states, I think we're going to need a federal government response. Otherwise, I don't see how we can do this piecemeal, Doctor.
Well, I agree with you, and we've been saying this repeatedly. I should note that about 5 minutes before this show, I saw a news report from Fox News in Arizona stating that Herman Cain was in the hospital. So this is very serious, and I think that we're just starting to see the tip of the iceberg of these cases going up. And I should note that with the summer being around, being able to be outside, you would have expected the cases maybe to have at least waned some. So this is not looking well at all for the fall. And in the fall, we will also be hit by a flu virus again. And those two combined have the potential of wreaking utter havoc on our healthcare system. And don't think just because you get the one virus, you won't get the other. You can actually get both at the same time. And so this is very bad that we're not able to do better than what we are doing. And other countries, when you look at the rates, for example, of Spain, their deaths and hospitalizations are almost approaching zero. They still have some activity of the virus, but they had a coordinated national response and took a catastrophe in their country and turned it into a very manageable situation. We, on the other hand, are unable to learn from experience. We just have political talking point after political talking point, and this virus ignores politics and just is rotating through our country, causing one hot spot after another. And unfortunately, no area, including New York and New Jersey and Massachusetts, has reached the level of immunity in their population that would indicate they wouldn't be susceptible to a second wave. And as we've discussed before, there are a number of studies out which are beginning to question whether or not we'll have long-lasting immunity to this virus. And so we should not count on that. Herd immunity is a false narrative. We need to prevent this epidemic from spreading.
There's no doubt. Talking with Dr. Kevin Kavanagh here on the Jeff Santos Show, General Chair at healthwatchusa.org. Check it out, folks. It's a great place for you to learn about not only the concerns, but basically some of the solutions as well, as they are a great resource for all of us. You know, one of the things that's happened, we bring up sports, as yours truly is a huge sports fan. Well, I found out over the last 24 hours, I don't know if it's totally confirmed yet, but everyone that I've talked to has confirmed it, that the National Hockey League, which is, of course, based in New York City, like all the other sports leagues, decided to put all their eggs into the basket of Canada. Well, they do have a single-payer healthcare system in Canada. They do have a quarantine system in Canada, so they're going to play their games in two sites, Toronto, Ontario, and Edmonton, Alberta. I think it's a smart move. It's obviously for a lot of teams in the Southwest and throughout the United States, in the Northeast of the Southeast, the distance, if you wanted to go and be in that city to see your team, you can't go into the arena anyways. But the fact is that it's smarter. And I'm just wondering, Doctor, from a pure health perspective, I think this is a great move because the Canada is a lot better off than we are. They are dealing with it. They have a healthcare system. We do not. Ours is state by state, and it's a whole hodgepodge of things. I don't know how you feel, but I think it was a smart move. Comparison to the NBA, which has put themselves plop in the middle of Orlando next to Disney, which to me is kind of a chaos if you think about it. But your thoughts there?
Well, as it turned out, it apparently is, because almost all countries are doing better than what we are. Maybe the exception of Brazil and Russia, but even the European Union is now barring travel from people in the United States, which I never thought I would see. I think originally the idea of going south was hoping that with the warmer weather, being outside, these states would have a lower incidence of the virus, but as we can see, that didn't work out too well. The epidemic is raging in our southern states. So it's very disappointing on how we've responded to this virus. It is very disappointing how we're continuing to respond to the virus. And at this point, contact tracing in the United States is, well, it's just not a good strategy. There's just too many cases. There may be some areas in the United States where that works, like New York City, New Jersey, Rhode Island, where cases are down low. But certainly in the states that have a raging epidemic, they need to get a hold of that epidemic. That's got to be their primary strategy. And contact tracing, they definitely need to do, but they're not going to have enough resources to contact trace all the patients. I mean, we have now over 50,000 cases a day in the United States. How can you contact trace those individuals along with all of their contacts? It's very, very difficult. We need to get this epidemic under control.
We're going to get to some solutions in a second. We'll also take your calls in a couple of minutes at 844-713-3459. We'll go to Rudy in Chicago and good friends John in Minneapolis as well. But I want to, before we do that, one thing that I think that it's really important to talk about is this idea of bars and nightclubs and what's going on here. I don't understand it. I've spent a lot of time, particularly in sports bars over the years, watching baseball games and so forth, and hockey and football. I wouldn't risk my life or my family's life in going to a sports bar or any bar for that matter right now. And I think that should be talked about by the President of the United States. I don't care if he thinks that governors are going to complain because you're losing business. Look, it's a health safety issue. Talk to me about this because it, to me, that has to be a priority. Bar, restaurants, you just can't do it right now. Unless it's outside, maybe you can make an exception that way. But even then, unless you have a massive parking lot next to you, you really only have, a handful of outdoor tables you can go to. Your thoughts, sir?
Well, definitely bars and nightclubs, at least in my opinion, are the most risky areas that you can have. Churches actually fall into a very high risk category, but they're not as risky as bars because in bars and nightclubs, if you're drinking and eating, you're going to be taking off your mask. And that's presuming you're wearing one to begin with. I don't see a lot of people wearing masks in grocery stores, probably not going to wear masks in a bar. But they're indoors, people are very crowded, it's very noisy, so they're talking loudly, which will aerosolize the virus, and they're not even within their family cohort. At least when you're in a church, you're not milling around exposing yourself to almost everybody in the place. A church, you can still socially isolate. You can hold it outdoors. It's really very, very frustrating. So social distancing is important. Hard to do it in a bar, possible to do it in a church. If you're going to have a bar, if you had it outside, more of a restaurant setting with tables apart, keeping people apart, but that kind of defeats the purpose in most people's minds of a bar. And so you don't see too many people or institutions setting up like that. I think they need to be, at this point, closed until we get a handle on this epidemic. And the idea and logic in saying, well, it's not bad here yet, so we don't have to close, that doesn't hold because people traveling in from other areas into your state, if they go there, they'll spread the virus, it'll go undetected for a number of weeks, and then when it becomes detectable, already now the barn is on fire, not much you can do about it, except hold on as for the rising rates, try to clamp down on activity, but you'll have a raging fire that's going to ravage your community, possibly your state, for a number of weeks until you can get it controlled. So preemptive prevention is what is the key, and that requires a national strategy, and it requires us not doing high-risk activities. I don't think bars are key to our economy. I don't think indoor dining is key to our economy. It's nice to have, but it's not like manufacturing, farming, things that are really productive. It falls on the side of entertainment. It is very important, but we do have entertainment options, and we have a way to do a lot of the entertainment safely. So that's what we need to do, is we need to try to do this safer and to live safer rather than taking risks and continuing to go through this skyrocketing of cases in the epidemic, which that will definitely affect our economy and our ability to really have a vibrant economy and job growth, etc. We need to get this infection under control.
No doubt. Talking with Dr. Kevin Kavanagh here on the Jeff Santos Show. Go to healthwatchusa.org and find out more about Dr. Kavanagh and, of course, about this pandemic. Let's go to Chicago and talk to our good friend Rudy, who has a couple of questions for Dr. Kavanagh. Go right ahead, Rudy.
Hello, Doctor. I I've had some thoughts about the coronavirus since we last spoke. It seems to me, let me tell you what I think. It seems to me that there's two elements of the coronavirus. One is severe inflammation. The other one is an overly strong response from your immune system. We have dexamethasone to treat the inflammation, and now you've got Ribosvir coming out for inflammation. In fact, it's been used for rheumatoid arthritis patients. The other thing would be, why don't we weaken the immune system so we can cut down on that strong response that does damage to your body? Stuff like methotrexate. What do you think about that?
Well, you were breaking up there a little bit, but I did get the subject, so I may not be able to answer the question exactly. But methotrexate is very good to give to someone once their immune system gets too high. In other words, if you're on oxygen, if you're on a ventilator, that's when they give that. If you were to give methotrexate to people, for example, who didn't have symptoms, then that could potentially increase your chances of you getting the infection. So there's a timing of that makes it beneficial. So those types of treatments are given to the severely sick. They're not really given for people who don't have symptoms or who have mild symptoms. So we still have a ways to go, and hopefully a vaccine will do that.
Yeah, it doesn't have to be methotrexate. It could be any drug that would weaken the immune system enough so that it couldn't do as much damage.
Is that right, doctor?
Well, again, the same principle is if you weaken the immune system on the front end, you may make the virus more likely to infect your system and spread. Immunosuppressants are given when you start to have an immunological response that is much more than you need to fight off the virus and is now causing harm to your body. So it's done mainly in people who are hospitalized and who are developing severe symptoms.
Thank you, Rudy. Appreciate it very much.
I just figured there's something you got to do to control the immune system. Weaken it is one way. I don't know if there's any other way.
Well, you want to heighten the immune system to not get the virus, but once you get it and you develop a lot of symptoms, you want to weaken it so you don't get severe symptoms and severe damage that's caused by the immune system. So there's a real timing there that needs to be done. Right. So in general, those type of strategies are done on very sick patients.
Thank you, Rudy. Okay. Appreciate it. Before we take the next call, I think another aspect here is we want to make sure that people don't catch it to begin with, understanding how to treat it once you do have it. And I think, again, whether we're talking social distancing, wearing masks, not going to these certain places, restaurants inside, bars, nightclubs. I want to throw in a couple of other things that are going on here, particularly in the coastal areas, California and Florida, is the beaches. And I worry with 100-degree temperatures in Florida now, and it's in the 90s all the way up and down the East Coast. Of course, California is a little bit cooler, but people like to go to the beach. I don't know how to do it. If you can somehow line people up and you give people, at least the thermometer, a temperature check, as they do when you go into restaurants or you go into dentist office or doctor's offices. I mean, maybe you can do something like that, but I think that Gavin Newsom in California did the right thing by closing the beaches. I don't know if he's closing them statewide, but at least in Southern California, because I don't know how else you can control it.
Well, I think controlling it is the key phrase there. I think it could be done if you cordoned off areas for family groups or family cohorts. People would stay in their area, not intermingle, but that tends not to happen. The public has really pretty much adopted the attitude, this isn't a problem, we're going to go back to normal. And the beach is just a big temptation for going back to normal. So, you can stay away from people, but if you were to actually rub up against somebody with the virus, that could result in transmission. So you want to be careful on that. But the beaches, in my opinion, are not nearly as dangerous as the indoor activities where you don't have the sun, you don't have the good ventilation, people are packed in, they're aerosolizing the virus and spreading it. And so I think that the bars, the nightclubs, indoor dining are the areas that cause me the most concern. And
No doubt. I mean, I like the idea of going to the beach. I love the beach, but I don't want to put myself in a situation where there are a bunch of people walking by me having a good time with a beer or whatever, and all of a sudden they affect me and friends of mine. I think that's kind of crazy. If you can get everybody a temperature check and then put them in organized areas, great. I think that's not going to be very easy to do in our sort of, let me be free society.
well, and I think that's the problem, is that you don't have the cooperation of the populace. Many are believing this is just a joke. We have reports of kids and young individuals having coronavirus parties where they put the money in a pot and whoever gets the infection first gets the pot. I mean, just craziness. There's a lack of understanding that just because you've survived the virus doesn't mean that you've recovered. A number of people who have been in the hospital have lasting disabilities and problems, especially if you're in the ICU. And this includes if you're young. You need to take this virus seriously. And right now, people are not doing that. And that's, be honest with you, Jeff, the main problem.
I want to take one quick call, but my good friend John in Minneapolis, and then we'll wrap this up. You're next, John, with Dr. Kevin Kavanagh. I'm running out of time, so if you make your comments or questions very short. Thank you.
Yeah, maybe you could speak to that, because I had heard Lori Garrett was interviewed, and she was interviewed by Amy Goodman. She's a Pulitzer Prize science writer, and she said that long-term disability is really what many of these people are looking at, and even, maybe not really severe cases, but they still would have some effect on their neurological system, on their cardiac system. It's really nothing to be
messing around with. I think you're right. Thank you, John. Dr. Kavanagh, I got 30 seconds. Go ahead.
Absolutely, I agree with you. And I think that our leaders need to change their narrative from this many people have recovered to this many people have survived. They don't know how many people have recovered. And from what I'm hearing, the majority of people that are in the ICU have lasting problems with this. And we have no idea how long it will last. The virus is just too new.
Dr. Kevin Kavanagh, thank you, sir.